Are you over 60 and facing a potential surgery? The thought can be daunting, can't it? As we get older, our bodies change, and what might have been a routine procedure in our younger years can carry significantly higher risks and a much longer recovery time now. Many seniors find themselves in this exact position, wondering if surgery is truly the best or only option. What if I told you that for some procedures, there might be safer, less invasive, and equally effective alternatives that could save you from unnecessary pain, lengthy hospital stays, and a difficult recovery? By the end of this video, you'll know exactly which 5 types of surgeries often come with increased risks for seniors, why they might not be your best first choice, and more importantly, what you can do instead to manage your health and maintain your quality of life. We'll explore powerful non-surgical options that many doctors don't always highlight. If you're over 60 and want to make the most informed decisions about your health, give this video a thumbs up. It helps us know we're providing valuable information for our senior community. And subscribe so you never miss health tips designed specifically for you. Deciding on surgery is a big deal at any age, but especially after 60. Our bodies simply don't bounce back like they used to. Healing can be slower, and the risk of complications, from infections to cognitive issues, can be much higher. This isn't about scaring you away from necessary procedures, but about empowering you with knowledge. It's about helping you have a truly informed discussion with your doctor, asking the right questions, and understanding all your options. Because sometimes the best decision is to explore every avenue before going under the knife. Now, before I dive into the first type of surgery, understand that every individual is unique. What might be risky for one person might be perfectly safe for another. Your overall health, existing conditions, and even your lifestyle all play a role. But these are general categories where seniors, especially those with multiple health issues or signs of frailty, should exercise extra caution. Remember, this information is for educational purposes only and is not medical advice. Always consult your healthcare provider. Let's begin with a procedure that often comes up when we talk about chronic back pain: spinal fusion for age-related back pain. For years, if you had persistent back pain, especially radiating down your legs, spinal fusion was often presented as the definitive solution. The idea is to permanently join 2 or more vertebrae, hoping to eliminate the pain source by stabilizing that segment of the spine. While it can be effective for specific conditions like a herniated disc that causes nerve compression or spinal instability, it's a different story when the pain is primarily due to general age-related arthritis or degenerative disc disease. The truth is, for many seniors with chronic back pain, spinal fusion may not offer lasting relief. Studies have shown that for generalized arthritis in the spine, non-surgical treatments can often achieve similar, if not better, long-term outcomes with significantly less risk. The recovery from spinal fusion is extensive. We're talking months of limited movement, intense physical therapy, and a significant risk of muscle loss, which can increase your fall risk, a major concern for seniors. I'm curious, have you or someone you know experienced chronic back pain? What treatments have you found helpful? Drop a comment below and let me know. Your experiences can help others in our community. Now, here's where it gets interesting. Many seniors who undergo spinal fusion for generalized back pain end up with something called adjacent segment disease. This means that the vertebrae above and below the fused section take on extra stress, eventually leading to new pain and potentially the need for more surgery down the line. It's a vicious cycle that can seriously impact your quality of life. So, what are the alternatives? For age-related back pain, a comprehensive approach often works best. This includes targeted physical therapy, focusing on core strength and flexibility, anti-inflammatory medications, steroid injections, and even lifestyle changes like weight management and ergonomic adjustments. Many seniors find significant relief and improved function without ever needing surgery. Some also explore complementary therapies like acupuncture or chiropractic care, which can be very beneficial. The key is to find a healthcare team that focuses on conservative treatments first. Next up, let's talk about elective cosmetic surgery. Now I know what you might be thinking. What does looking younger have to do with health? Well, while there's no medical need for these procedures, the recovery process can be surprisingly challenging for an aging body. As we get older, our skin becomes less elastic, our blood vessels are more fragile, and our immune system isn't as robust. These factors mean a higher risk of complications during and after cosmetic procedures. Think about a facelift or a tummy tuck. These are major surgeries that involve significant incisions, tissue manipulation, and extended healing times. For seniors, the risks of infection, excessive bleeding, poor wound healing, and even adverse reactions to anesthesia are all elevated. What might be a relatively straightforward recovery for a younger person can become a prolonged and difficult ordeal for someone over 60, potentially leading to months of discomfort and unexpected complications. Coming up in just a moment, I'll share some fantastic non-invasive alternatives that can help you look and feel your best without the risks and downtime of surgery. But first, let's consider another type of major surgery. Before we get to that, remember the importance of supporting your body's natural healing capabilities. Good nutrition, adequate rest, and managing stress are crucial, whether you're recovering from an injury or just trying to stay healthy. The third category is major cancer surgeries, particularly complex tumor removals. Cancer treatment is incredibly personal, and sometimes aggressive surgery is indeed the best path forward. However, for some frail or elderly individuals, especially those with advanced cancer, the balance between potential benefits and significant risks shifts dramatically. These surgeries can be lengthy and put immense stress on the body. For an older adult, this can mean a much higher risk of surgical complications, a longer stay in the ICU, and a challenging recovery that may severely impact their quality of life. It's a tough conversation to have, but for some, an aggressive surgical approach might shorten life rather than extending it, or significantly reduce the quality of the time they have left. This is why it's crucial to discuss all options with your oncology team, including targeted therapies, palliative care, and simply careful monitoring. The goal should always be to maximize both quantity and quality of life, and sometimes less aggressive interventions are the kinder and more effective choice. If you're finding this helpful, please share this video with a friend or family member who might benefit from this information. It could truly help them make a more informed decision. Now, let's talk about some of those wonderful alternatives for cosmetic concerns I mentioned earlier. You don't have to go under the knife to rejuvenate your appearance. There are incredible non-invasive treatments available today that can deliver impressive results with minimal downtime and significantly less risk. Think about things like radiofrequency energy treatments that stimulate collagen production and tighten skin, or laser resurfacing to improve texture and tone. Chemical peels can exfoliate and reveal smoother, younger-looking skin. Dermal fillers can restore volume, and neuromodulators like Botox can reduce wrinkles. Even treatments like Ultherapy, which uses ultrasound, or PRP therapy, using your own blood to promote healing, can make a significant difference. These options allow you to enhance your appearance safely and gradually. My fourth type of surgery to approach with caution after 60 is aggressive spinal surgery, especially multi-level procedures. This is closely related to our first point about spinal fusion, but focuses on procedures that are particularly complex and extensive. When multiple levels of the spine are involved, the surgery becomes much longer, the blood loss can be greater, and the overall stress on the body is multiplied. The complication rates for these aggressive spinal surgeries in older adults can be incredibly high, sometimes exceeding 40%. We're talking about risks like blood clots, infections, nerve damage, and long-term structural problems that can lead to chronic pain and disability. What many patients don't realize is that for many degenerative spinal conditions, non-surgical treatments often yield comparable long-term results to these aggressive surgeries, but without the extreme risks. Pay attention to this next part. Studies have consistently shown that for conditions like lumbar spinal stenosis, which is a common cause of leg pain and weakness in seniors, conservative treatments like physical therapy and epidural injections can be just as effective as surgery in the long run. The recovery from a multi-level spinal surgery can be brutal, leaving seniors weakened, prone to falls, and dependent on caregivers for an extended period. It's vital to exhaust all non-surgical options and get multiple opinions before considering such an extensive procedure. Drop a comment below and share any experiences you've had with non-surgical treatments for pain. What worked for you? What didn't? And finally, the fifth category, elective joint replacement in high-risk individuals. Now, this one is a bit nuanced because joint replacements, especially hip and knee, can be truly life-changing for many seniors. They can restore mobility and eliminate debilitating pain. However, for older adults, With multiple pre-existing health conditions, the risks can quickly outweigh the benefits if proper precautions aren't taken. If you have uncontrolled diabetes, severe heart disease, significant lung problems, or are generally frail, the risks of complications like blood clots, infections, and a prolonged, difficult recovery increase significantly. Imagine trying to recover from a major knee replacement when your heart isn't strong enough to handle the stress, or your lungs are struggling to provide enough oxygen. It can lead to a cascade of problems. The good news is that for many, these risks can be mitigated. If you're considering an elective joint replacement, it's crucial to optimize your health beforehand. This is where prehabilitation comes in. This involves working with physical therapists to improve your strength, flexibility, and cardiovascular health before surgery. Getting your blood sugar under control, managing your blood pressure, and even losing a little weight can drastically improve your outcomes and shorten your recovery time. It's about being proactive and giving your body the best possible chance to heal successfully. But here's what most doctors won't tell you. Even if you don't have multiple comorbidities, there are specific risks associated with anesthesia for seniors. Older adults are more susceptible to post-operative delirium, which is an acute state of confusion after surgery. While often temporary, it can increase complications and lengthen hospital stays. Even more concerning is post-operative cognitive dysfunction, or POCD. This can lead to long-term memory loss and difficulty with learning, concentration, and thinking. It's a more serious and potentially lasting impact on your brain health. This doesn't mean you should avoid surgery entirely if it's truly needed. It means having a detailed conversation with your anesthesiologist about less invasive anesthesia options, like peripheral nerve blocks, epidurals, or spinal anesthesia, combined with conscious sedation. These can protect the aging brain and lead to faster, clearer recoveries. Always ask about the type of anesthesia being planned and if there are brain-sparing alternatives. We've covered 5 types of surgeries where seniors should exercise extra caution and consider alternatives. But the journey doesn't end with choosing or avoiding surgery. Recovery is a critical phase, and for seniors, it often takes longer and requires a more comprehensive approach. Functional recovery can take anywhere from 3 to 6 months or even longer, depending on your preoperative physical status. So, how can you ensure the best possible recovery if surgery becomes necessary? First, prioritize rest and nutrition. Your body needs ample sleep and a diet rich in protein, fruits, and vegetables to support healing and immune function. Hydration is also vital. Second, focus on early mobilization. Unless your doctor says otherwise, getting up and moving around as soon as safely possible, even just gentle walking, significantly reduces the risk of complications like blood clots, muscle loss, and pneumonia. Third, embrace physical therapy. A personalized program is essential for regaining strength, improving mobility, and recovering function. Don't skip your sessions. Fourth, meticulously manage your medications. Take all prescribed medications, including pain relief and antibiotics, exactly as directed. Fifth, attend all your follow-up appointments with your surgeon. They are crucial for monitoring your progress and catching any potential issues early. Sixth, make your home environment safe. Remove tripping hazards like rugs, secure loose cords, ensure good lighting, and install grab bars in the bathroom. This prevents falls, which can be devastating during recovery. And finally, be patient and accept support. Recovery is a process. Don't hesitate to ask for help from family, friends, or professional caregivers for daily tasks. You're not alone in this. Let me quickly recap what we've covered today. We discussed spinal fusion for general back pain, elective cosmetic surgeries, complex cancer surgeries for frail individuals, aggressive multi-level spinal surgeries, and elective joint replacements for high-risk individuals. We explored why these might be approached with caution after 60 and highlighted various non-surgical alternatives and strategies for a safer recovery. Now, here's what I want you to do. If this information was helpful to you, give this video a thumbs up. It really helps me know what content you want to see more of. And tell me in the comments which of these tips resonated with you most, or which alternative treatment you might explore first. I read every comment and I'd love to hear from you. If you know a friend or family member who could benefit from this information, especially if they are considering surgery, please share this video with them. It could make a real difference in their life. And don't forget to subscribe and hit that notification bell so you never miss our health tips designed specifically for seniors like you. We're building a community here to help each other thrive in our golden years. In my next video, I'll be talking about surprising ways to boost your brain health after 60. You won't want to miss it. Remember, always consult with your healthcare provider before making any changes to your health routine or making decisions about surgery. Your doctor knows your individual health history best. Thank you so much for watching. Take care of yourself, stay informed, and I'll see you in the next video.